Surendra Nehru, MD physician. I've been working on insulin resistance since 8 years. My number is 0996372199. Recently, one of my friends, a cardiologist, he has asked me to get for a patient fasting insulin test. With great difficulty, I am able to tell doctors to get a fasting insulin test along with blood sugar. They are asking me why already we are doing fasting blood sugar, HbA1c, random blood sugar. What is the need of doing a fasting insulin? So with great difficulty, I could convince him and got a fasting insulin. So now he sees the patient. He was having a on and off chest pain with non-specific ECG changes, strong family history of diabetes, hypertension, coronary artery disease, and the waist circumference is more than 100 centimeters. A young software guy with around age of 38 years with waist circumference, central obesity of more than 100 centimeters, and height and weight, BMI is normal. Once you see the report, the blood sugar is normal. So because the blood sugar is normal, the doctor was not interested to get a fasting insulin. On my pressure, he got a fasting insulin test done. The fasting insulin in India, the report shows 2 to 25, international units is normal. So he was arguing the sugar is normal, the fasting insulin is normal. I got a peculiar couple, both are software. Wife wants to get only fasting insulin test and husband wants to get only fasting blood sugar done. That is one peculiarity. This case, if you see, the fasting insulin is 20 and fasting blood sugar is 90, so he is a euglycemic. So this is a case of once you multiply fasting insulin to fasting blood sugar, divide by 405, the HOMA-IR is the insulin resistance is more than 2. So any Indian with waist circumference more than 85 centimeter from the age of 20 years with insulin resistance more than 2, we are suggest of the patient is going into insulin resistance. These patients, the chance of getting diabetes and heart attacks are high. This is the entire concept. So just doing a fasting insulin test will not help. Just by doing a fasting sugar, it will not help. And some of the doctors, just because they do a fasting insulin and see the report value between 2 to 25, they think it is normal. But if you do the HOMA-IR formula is not given by any lab test. So this is nothing but fasting insulin to fasting blood sugar divided by 405. If it is more than 2.3, this patient, the chance of getting fatty liver and diabetes and heart attacks are high. This is called homeostasis model of insulin resistance, called HOMA-IR. You can come to my site www.homahealthcarecenter.in or to my YouTube, Muddu Surendra Nehru. You get a lot of videos on insulin resistance and homeostasis model. Why this is important is these are till 90% of the beta cells are getting destroyed, your sugar will be normal. So what all you eat will be converted into triglycerides. Peculiar in India because of the high carbohydrate diet, our sugars will be normal, but our insulin levels will be very high. So I request every doctor do a HOMA-IR test, not only fasting insulin and fasting blood sugar, but also go for a HOMA-IR test. If you have any doubts, you can comment on my videos. This is for general public also. Recommend and request to get a HOMA-IR test. This will save the country and join Quit India Diabetes and Obesity campaign. Thank you.